many aspects, as I said. Obviously, the cost of the device itself. Um, uh, if all being equal, the cost of this device versus another thrombolytic device, which you have to use two of them, so the purchase is different. You don't have to purchase a console for the device, uh, less use of a sheath, less use of a drug. I understand the TPA cost money, so that's saving that you will incur. You don't transition the patient in the ICU with all the staffing and everything required by the ICU. Um, and so, financially speaking, you really do very well with this. And then the fact that you empty a bed is a big deal. Now, we live in an environment that there's a lot of limitation in terms of beds when you're a tertiary care facility and you're trying to get patients from outside. I'm sure everybody at some point will decline the transfer because of bed availability. So I'm telling you, we have an ICU bed available, and then next day we have a floor bed available. That patient, if you go into a different therapy, would probably be in the hospital anywhere between 3 to 4 days. I can clear the bed on the second day, which is a major thing because, again, financially speaking, the hospital will get another patient, which means another revenue coming in, but also patient uh, needs are met, obviously, by having an availability for beds. So the bed availability, the lack of ICU time and ICU cost associated with it, and then the simplicity in the cath lab, all of this obviously collectively help the hospital. The fact that you can do a procedure in half an hour as opposed to maybe other procedures that take an hour and a half mean that you can add another one or two procedures that day. Versus if I'm doing a very complicated procedure, this means that one of the other patient, not only the PE, but the other patient has to be bumped to the following day if this is done at the end of the day.